Excellent. Well, I would like to welcome Kevin Brady, great colleague and friend of mine. He's the founder and CEO of Advoca Health, and they have basically the largest employee focus. Basically, he saw a big need in the market and decided to open up a company on health navigation. And I'm going to let him share his story because it's very powerful. And I'll let you get started there, Kevin.
Okay, great. Thanks, Diamond, and nice to see everyone this evening or afternoon or wherever you are. So just to share a little background, I've been in the health business for over 35 years. And more specifically, I was in the employee benefits business. I'm just going to share how I got started with this journey in my company. So I was in the employee benefits business with one of Canada's largest insurers. Then I went out and started my own employee benefits consulting firm where we would look after the benefits, employee benefits for companies, their health, dental, pension plans, that type of thing. And through that work, what continually seemed to happen was that people were reaching out to me with health issues and asking for my assistance in getting them through the health system. Everything from just MRIs to serious situations like cancer or heart or that type of thing. And to share one story in particular, it was a business owner that actually is still a client of ours today. Through testing that I'm going to talk about today, advanced testing, we were able to determine that he had stage 1 kidney cancer. Kidney cancer or any cancer, obviously none of us like to hear it, but when you want to get it is in its early stages, right? It's like heart disease or other things. And with him, we were able to diagnose it in stage 1, get it blasted out, and then years later, he's living a very healthy life. And it kept happening over and over again. And I thought there's got to be somebody in Canada doing health navigation. So I went out and did a request for proposals across Canada for health navigation and soon found out that no one in Canada was doing health navigation. So I went out and hired a nurse, more as a support business to my employee benefits business, and it just grew and continued to grow. So I started this company called Advoca Health, and the name is what we do. We're advocates for your health. And now we're right across Canada. HeartFit's one of our amazing partners that we work with in terms of advanced testing in coronary and cardiovascular disease. So I'm really here today to talk about your health, which I consider is our biggest asset. And I think a lot of us, including me, I took my health for granted until I had a wake-up call. And I'm going to share my own story with you in a few moments. But I would ask that you treat the next 45 minutes seriously because I don't want you to do what I did and take your health for granted. So please treat it seriously because I don't think there's anything more important than our health. So to start things off, what I'd like you to do, if my screen will move, is just write down on a piece of paper, think what is one area of your health that you would like to improve upon? And for those that aren't shy, if you wouldn't mind just putting it in the chat, and Diamond, maybe you can just let me know what some of the responses are. So what's one area of your health? And there's no wrong answer here, right? It could be exercise, could be weight loss, could be mental health. So Diamond, maybe you can just share some of the responses because I hope to address these as part of my talk.
I think one area I'll actually go first if that's okay. And
Sure.
I think one area of my health I think is super important is to make sure I have a little bit more balance into what I do because as a business owner and being of service to many people, I got to make sure I take care of Diamond too. And so I feel I do a pretty good job, but I always think there's always room to improve in taking care of myself on that end of it. And so, but yeah, that's one thing area of health that I would like to make sure of is more. I'm going to talk more the stress side of things because we got the sprint and recover side of things, and I want to make sure I recover well, sleep well. Those are the things that I think are very important, especially when it comes to that, because you only got one life, we got one heart. You got to be able to take care of it and do your best for that side of things. So I'll start with that.
Yeah, awesome, perfect. Any others in the chat at this point, or
Physical wellness was one. We had weight loss, heart health, of course, very important. Um, Advanced options to manage autoimmune conditions. So there's a lot of autoimmune conditions out there. Working on cardio, keeping blood pressure under control, weight loss, diet, energy health. Great answers here. Muscle strength, regular fitness, weight loss. So a lot of great answers here.
Awesome. Well, I hope to address most of those as I go through my talk today because I hear them every single day, and that's really what we do is we help people get the very best health solutions. So first thing I'm going to do is just share my own story, and I'd like everybody just to go back to 1999 and just think, where were you in 1999? What was your life? How old were you? How old were your kids? So back in 1999, just to share where I was at, I was 36 years old. I just started my own business. Speaking of balance, Diamond, I had
Yeah.
3 kids under 8 years old, 8, 5, and 2. And I like to refer to myself as the old Kev. So today's Kev, 6'2", 178, 180 pounds. The old Kev, 6'2", 235 pounds, right? But I was a tall guy. I could wear it and actually thought I was healthy because I worked out every day. That was my feeling like as long as I work out every day, I'm in good health. Well, let me share what happened May 30th, coincidentally, today's date in 1999. So May 30th, 1999, I was running my 5th marathon. It was actually a fundraiser for the hospital. And it was a little warmer that day. Finished the race, wasn't feeling well after the race. So I went to the medical tent and the head doctor, who also is a marathon runner, took my blood pressure, took my heart rate. He said, Kev, your heart rate's a little high and your blood pressure's a little high. But he said, go home. He said, you're fine. Go home. Well, fortunately, because I had run other marathons, I know generally after, for any of you that have done a lot of cardio, generally after a cardio event, cardiovascular or a run or bike or whatever, you're recovering really, really quickly. And I wasn't. I was going the other way. And so I wasn't feeling well at all. And my wife actually had backed up the truck to the finish line for me to hop in because we were then going to take our kids. One of our kids was in a recital. So my wife backed up the truck. And I just said, I'm not going with you. I said, I don't feel well. I'm going to stay here and just try to recover. So she said, okay, I'll go to the recital. I'll come back and pick you up after. So, anyways, I went off to this area where nobody could really see me, and I was guzzling Gatorade and trying to feel better. And I was going south. I was going the other way. And when people say, "How did you feel?" I actually felt like I was going to die. I guess I felt death. I felt it was so close. So I finally mustered up all my energy and went over to the medical tent again and just demanded an ambulance. I said, I need an ambulance. And my wife had left our 8-year-old, who was our oldest at the time, with me at the time. So the last thing I remember is just being helped into that ambulance with the help of the paramedics. And then I obviously just passed out once I was in the hospital or in the ambulance because I don't remember a thing. They rushed me to a local hospital. And my wife by this time was on her way back to pick me up. And little did she know that the ambulance that she passed with the lights flashing and the sirens wailing, that I was in the back of it with my 8-year-old. In reading the medical reports, when I got to the hospital, it took 11 doctors and nurses to tie me down because I was convulsing so badly and seizuring. And so they heavily sedated me, and then they did a bunch of tests, and they realized I was in serious shape. In fact, they shipped me off to a specialty hospital where I remained in intensive care and in a full coma for the course of a week. For a full week, I had machines that were keeping me alive, a respirator, a ventilator. I had machines that were keeping me alive. And in fact, on the Wednesday, they called my wife in. So the race was on a Sunday. Wednesday, halfway through the week, they called my wife in, and they told her to get our affairs in order. That I had less than 10% chance of living. The good news is I did obviously wake up because I'm here today. I came out of my coma, had a long recovery, took probably 2 or 3 months. And for a number of years, I blamed the heat and blamed other things. But when I look back, I was fit, as I said, but I wasn't healthy. My diet wasn't good. My sleeping wasn't good. I just started my business. I had high stress levels. I had 3 children under 8. Diamond, to your point about balance, I was not balanced. I thought I was balanced because I worked out every day, and I thought as long as I work out, I'm good. I was dead wrong. So I finished that marathon, and actually the clinical name, because I always get asked this for what I had, was called hyponatremia, which is low sodium, low magnesium, low mineral levels in the blood. And if I had had a test that I'm going to share with you in a few minutes, I would have known that I don't absorb those things readily. So now I take supplements and other things so that that type of event doesn't happen again. Again, more on the proactive side of things. Diamond, just before we go on, speaking to you as a doctor, any questions or comments on that experience?
Well, obviously, I just got back from the European Society of Cardiology speaking there last month. For those of you, I promised that I'd send you the recording, and I will do that still. It's already uploaded on our channel, so I'll definitely send that to you guys. Happy to send that to you too, Kevin. But the point of why I'm trying to make that is that most of that conference was talking about athletes and marathon runners and just recreational athletes, and knowing that, okay, well, this is where we want to be able to go when it comes to cardiovascular disease, and how to prevent it. But there is an immense amount of people that do long endurance training that have calcification and then are putting themselves at risk of cardiovascular disease. And so we are not meant to be running marathons. Just our bodies are not designed to do that. And I think you said it perfectly well. If you do not supplement well for the training that you're about to do, your arteries will take notice. And that's where the process of atherosclerosis can come into play. So it's great to train, great to be able to do those things. And I know, Kevin, like just like myself, I have a family history of coronary artery disease. My father had his first heart attack at 38, and now is still a patient of ours in our clinic, living with heart disease more than he's living without now in terms of age. And obviously a big inspiration for a lot of our patients when he comes into the clinic. But I know you have the same thing, and that's where we can now change our genetics or turn them off and on based on what you do. And I'll let you get into that side of things a little bit more. But anyway.
Yeah, great comments. And I think, I race triathlons now. I've switched from marathons. I'm a lot smarter about balance and everything else. But when you say, a lot of athletes, like every year, I hate to say it, but people die doing that sport, right? In races, right? Because of the stress, and they may have calcification or other heart issues, and they aren't
Just got to
aware
be
of
able to do the right things so that if you love marathons and triathlons, great, no problem. It's just you got to make sure you put your body in a state that it can replenish well,
it.
because
Yeah.
it doesn't like it otherwise.
Exactly. So I'm going to share some testing that if I had done this testing, I would have known in advance that I need to supplement with those things that you're talking about. So
Yeah.
yeah, thank you. So I'm a slow learner like a lot of us, so I needed another wake up call. I'm not sure how many in the audience go for an executive medical every year, but I would go every year. And an executive medical is not just a normal doctor's visit; it's where you go and have all your blood tests, and you have some I'll say limited cardiovascular testing, also all your blood levels, all that type of thing, all in within probably half to a full day. And I would go every year, and pretty much the results would be the same, and they'd say everything's good and no issues. So this is now 10 years after my marathon. I would go every year. So I went again in 2009, and the doc came in after, but this time he pulled out his prescription pad, and he said, "Kev, got to put you on some scripts." And I said, "For what?" And he said, "You have high cholesterol, you have high blood pressure, and you're diabetic." And he could tell by the look of shock on my face that I was just totally, I was totally taken back. And I'll never forget a couple things he said to me, because the first thing he said, "Kev, you're in your 40s." He says, "That's normal. It's normal to go on these supplements." And for me, I thought, you know what? I don't think that's really normal. And the other thing he said when I asked
Yeah,
him
these
what,
medications, not supplements, though, right? So
yeah, that's
yeah,
exactly. Yeah.
yeah.
Yeah. Yeah. You need to go on meds. And then the second thing I said to him, I said, I've pretty much been had the same diet, and I've been coming to you for 5 years. Like, why all of a sudden is everything off out of kilter, like in the danger zone? And he pulled out my chart, And he showed me a graph, and it was kind of this upward graph. And he said, Kev, he says, for the last 5 years, all your levels have been going up. Your cholesterol has been going up. Your sugar levels have been going up. Your blood pressure has been going up. And I said to him, why? Well, why didn't you tell me? And his answer, and I bet you can guess the answer. The answer was, well, you weren't in the danger zone. And I said, what do you mean? You know, when you get your blood tests and it says you're in the norm, for all those years I was in the norm. So even though it was going up every year, he never shared with me that there was a problem or likely to be a problem in the future. And I just thought, man, is that our medical system? Like we actually wait for things to happen before we fix them. I compare it to a car. Do we wait for our car to break down before we go get it serviced? No, I think most of us, the service light goes on and we go get it serviced, right? So it totally set me back. Anyways, I begged him to give me 3 months. I said, give me 3 months. I'm going to change my life around. And of course, as a doc, he rolled his eyes. And because he's heard this, he's been to this movie a lot of times, right? Where people say, oh, I'm going to change my lifestyle, I'm going to change my diet. And I said, give me 3 months. So I said, even if you give me the scripts, I'm not going to take them because I'm going to change things around. So, anyways, he agreed. He said, I'll give you 3 months on the condition that if you have any symptoms, any heart palpitations, anything else, that you go directly to the hospital. So we shook on it and I left and I went home that night and shared with my wife. And I said, I told her what had happened and she had just engaged a nutritionist. I don't know how many people have gone to a nutritionist, but she had a whole plan. And I just thought, you know what? I'm just going to go on her plan. So I started going on her plan the very next day. And I'm going to share this in a couple of minutes because I started feeling well right away. I was feeling better, sleeping better, had more energy, losing weight. People were noticing. They're going, what are you doing? You're doing like something's different about you. In the course of that first month, I lost 14 and a half pounds. So I called up the doc and Dr. Randy and I said, Doc, I'd like to get my blood tested. And he said, and I remember his response. He said, Kev, you've been abusing your body for years. You're not going to change things around in 1 month. I said, just for fun, send me the requisition. So he sent me the requisition. I went and had my blood tested. Didn't hear anything from that week. The next week, I get this call. I don't even know who it is. Get this call, and it's at the other end of the phone. You're my star patient. And I said, what? Who is this? He said, it's Dr. Randy. He says, I don't know what you've been doing, but he said, I just got all your blood work back. He said, all your readings aren't just in the norm, they're the low end of norm. He says, your cholesterols have dropped like a rock. He says, your sugar levels are not just in the zone, they're at the low end of the zone. He said, you've told me you lost 14 and a half pounds. I bet your blood pressure is also in line. He said, I don't know what you've been doing, but keep doing it because it's working. And that's when the light went on for me. And you see a picture there. That's the old Kev, the 235 Kev. And that's actually a good picture of me. I had not so good pictures. And now I race, and not to brag, but I mean, now I race triathlons at the world. I'm going to my 8th world championships this year in Spain, representing Canada. So it just shows that when you dial in your health, and I'm not perfect by any means, but it just shows, the body wants to be well. The body wants to heal. We just have to allow it to. And that's what I'm going to talk about in a few moments. So, Dinah?
Yeah, I just want to, if it's okay, and I know I got permission from you, but you've come in and done our testing at the clinic in terms of understanding cardiovascular health, and you're doing all the right things, and even your markers show that as well. And so that's always the nice thing, to be able to have that confidence to be able to say, okay, well, I'm still on the right path, and that's the important part, and keeping there, and that's where it makes sense to be able to pay attention to those imbalances that we do have from a nutrient perspective as you start to push yourself, so that you can balance things and make sure your arteries stay healthy as well. So
Yeah, all great points. And yeah, it wasn't just a quick fix. It's been, I'll say, a long-term fix now, right? It's 2024 now, right? So it's continued. So one of the questions I'm often asked is, what did you change? Like when I said I came home and I followed my wife's routine and I just changed it. So I'm often asked, what did I change? Well, I changed two things. The main one is what I call the Wilson shake. And I don't know how many people, maybe in the chat, you can just put if you start your day with a shake. So that's my dog, Wilson. Wilson lived to be 19 years old. And so I start every single morning with a shake, and I'm not talking a little silver bullet. I'm talking a 2 liter shake that I start every single day with. And it is like I've had thousands of people that have changed their daily routine to include the Wilson shake. And don't there's no supplements. I don't make any money off this. I just see the change in people all the time. In fact, I had a business owner that owns some car dealerships reach out to me last week, showed me a picture of a shake again and him having the shake. And he called me after. He said, I've been working out and doing things I thought for years. I could never lose weight. I didn't have energy. He said, I started your shake. And he says, initially it didn't agree with me because there was all this goodness going in. I'm going to share the recipe in a minute. But he said, then after that, he said, I feel better than I've ever felt. He says, I have more energy. I'm sleeping better. He said, I'm actually doing 2 workouts a day. So just, it's had a big impact. And just to share the recipe, because I'm sure everybody has different recipes on it, it is, and I can send this out after, but very simply, everything's organic. So I use all organic, so things that aren't don't have pesticides and those types of things. I basically put frozen strawberries, blueberries in it, put about a cup of that in. And again, I can send out the recipe after. Then I put some powders in it, flaxseed, chia seed, and hemp seed for roughage to slow digestion and get healthy fats going through your body. I then put produce in it and I fill it to the brim with produce. And that could be assorted greens, arugula, salad from the night before, carrots. I basically fill the thing up with produce. Then I put some powder in it, and for me, I use plant-based protein powder or amino acids. Right, one or the other is what I put in. Sometimes some cacao, sometimes some spirulina, chlorella. I kind of mix it up every day, and then I fill it up with water, hit the button, and our dog Wilson would run in every single day. I hit that blender for his share of the Wilson shake. And of course, everybody bugs me. All my buddies say, no wonder your dog live to be so long. You gave him the Wilson shake every day. So I start off pretty much every single day with the Wilson shake. And again, we'll get the recipe out as part of the slide deck when we're done, if that's okay.
Thanks so much.
And the other thing is, I don't call myself vegan, but I've gone mainly plant-based. So most of my diet is now plant-based. Whereas at one time it was full-on meat pretty much every meal, right? So, and I'm not saying you should go that way. I'm trying to share what's worked for me. And those are two, if I kind of say what are the two major changes I made, those are the two changes I made very quickly to get my blood tests in order. Okay. Diamond, any input or comments before I switch gears here?
No, I think maybe everyone's obviously eagerly awaiting that concoction of the shake there. But so, yeah, I mean, I'll attest to the same thing. I have a smoothie every morning when I wake up, and I do that religiously just because it's so important. And I put all the good stuff that I talked to you guys about it and putting in terms of improving heart health, and very similar to yours. It's really about getting those foods that are antioxidants, so it takes away the oxidative stress that happens from daily wear and tear on our bodies, right? So that's always important.
I'm actually drinking a turmeric tea as we speak, and anti-inflammatory.
Uh,
There you go. So I'm going to switch gears now and go into the top 10 things that you can do to protect your health. Some of these you may have heard of, some you haven't, and a lot of it is around advanced testing, like you would get through HeartFit Clinic. But things that we see on a daily basis change people's lives. And as I say, some of these you may have heard, and others you likely haven't heard of. The first one is something I talked about a few years ago that at the time nobody had ever heard of, and that's having instant access to a medical professional, and otherwise known as virtual health. So virtual health is, and these services are all readily available today in the marketplace. It's something our company offers, but there's other services out there as well. And really my intent today is just to share what's out there in the marketplace that you can take advantage of. So the opposite of virtual health is going to a walk-in clinic or perhaps emergency. And I think when our kids were young, when our daughter had, let's say, strep throat or a sore throat or an earache, my wife and I would look at our schedules and say, okay, who has time to take her or one of my boys to the walk-in clinic. And then you'd go and you'd line up and you'd be there for an hour, hour and a half, and then you'd walk away with a prescription for whatever it was. So what virtual health is it's a walk-in clinic on your phone. Walk-in clinic on your phone, from everything from diagnosis to actually prescriptions. So the service we use actually uses doctors. So within 1 minute, 24 hours a day, 7 days a week, 365 days a year, you talk live to a doctor, get if you need diagnosis, get prescriptions, get whatever you need. And it can include some medical testing as well. So for those that haven't used virtual health, I would encourage you to look it up. It's a time saver. It allows you to avoid going to a walk-in clinic or emergency room. Not that you shouldn't go to emergency. There are cases when you should go to emergency, but for routine things, virtual health does the job.
And I'm gonna just pipe in because I think you're very humble in sharing what you do. But I think, you know, Kevin's services, what you do with this part of it is so valuable. And so it's such a game changer because we're in 2024. I mean, we're in a different world than we were, gosh, even 20 years ago for that matter. And so, I mean, I would definitely invite, and I'll give you guys all his contact afterwards, but definitely invite you to connect with Kevin because this is and his team because this is something that he does as well, and it's such a valuable thing for any families or anybody who needs that instant that walking clinic at your fingertips. That's super valuable.
Thanks, Simon. So, and virtual health is great, but unless it's black or white, in other words, unless the doctor can diagnose it and say, yeah, you have a rash or you have strep throat or you have this, they're going to send you back to the medical system. And I'm not sure if you've looked at the latest stats, but from Stats Canada right now, the average wait time in Canada from the time you want to see a doctor until you actually see a specialist is 26.5 weeks. That's half a year of wait. And that's where the next service comes in. And that's what we call, sorry, it's not moving. Oh, went to, is health navigation. So health navigation is simply somebody putting their arm around you, and I say somebody, a medical professional, and helping you get through the system quickly and efficiently, getting the right treatment at the right time versus waiting 4 or 6 months. So that would be everything from MRIs to CT scans, specialist appointments, whatever is needed. And a good service, and I can speak to Diamond's point, I mean, a good service like ours will recommend testing, such as the HeartFit Clinic, if that's needed. They'll also do, yesterday comes to mind, I had a situation with a cancer situation. I didn't do it, but I know today that individual's family will be talking to the best cancer specialist, not in the province, but in Canada and likely the world, right? So instead of waiting and going through the system and everything else, a good concierge service will navigate the system and advocate for you on your behalf. And I don't know if any of you, I mean, I used to do this on my own. I used to try to navigate the system on my own. It's super tough, right? Some of our members of our program refer to our program as having a doctor in your family, right? Because we all know if you have a doctor in your family and you have a health issue, then they're going to call their friends, call the specialist, get you in, get you through, get what's needed. And that's really what this service is. It's like having a doctor in your family. Okay. I'll move on to the next one, which is what we call second opinion or expert medical opinion. Expert medical opinion is you've been diagnosed with something and you want to get another opinion on it. So we have a chief medical director, and we ask our medical director, when should you get a second opinion? Their response is every time, because there's different ways to treat things. There's different procedures. And I'll just share the service we use is we use a consortium of hospitals from, locally in Canada, as well as Duke, Harvard, Mayo Clinic, Cleveland Clinic. Again, some of the best in the world. And you don't need to go there. All you do is simply sign a consent form, and then our team will gather all your records, all your imaging, anything that's been done, send it down to the specialist, to one of the best in the world, to take a look at your file and give you an opinion on it. And again, you look at the stats at the bottom there, it's pretty disturbing. 37% of the cases we send for second opinion are a misdiagnosis, meaning you weren't even diagnosed with the right thing in the first place. And 65%, it's a change in treatment, meaning, you know what, have you thought of this treatment versus this treatment? And I'll just use my own personal experience. I was last year I was over in Italy, and I was training, and I tore my meniscus really bad, meniscus in my knee, to the point I was on crutches coming home. So I got home, went and saw the orthopedic surgeon. He said, "Yeah, your meniscus is torn. You need surgery." And I still thought, you know what? I'm going to get a second opinion on this. So I signed the consent form. Our team sent it down. They actually sent it to Harvard. And 2 or 3 weeks later, I'm talking to the doc from Harvard. And he said, "Yeah, you've torn your meniscus." He said, "Surgery is an option, but there's another option." The other option was called PRP, which is where, I don't know if you've heard of PRP, but they take your blood out, they spin it for about 4 or 5 hours, and they re-inject it. And within a week after that, my torn meniscus was actually filled in, right? It had healed. And a month after that, I was actually racing again at the World Championships in Abu Dhabi. So it just, and that's all through having a second opinion. So my point is, we always think of second opinions when it's cancer or heart or serious situations. And I'll say you should get a second opinion all the time in those situations, but it could also be for a torn rotator cuff or a knee situation or any medical situation. So my message here is always get a second opinion, right? Is really the message. So Diamond, any comments? Or I mean, you're a doc. Do you believe in
Uh,
that
Not a
philosophy?
doc, but it's healthcare professional. From that side of things, it's always important to be able to look more at what you can do. I mean, we get a lot of people, especially when we know when it comes to cardiovascular disease, and the trials now share that is that you don't always need to go and open arteries up with stents and bypass because based on the ischemia trial, there's a way of treating stable coronary artery disease with optimal medical therapy, and with the treatments that we do with external counterpulsation therapy, it's a great treatment to basically grow new arteries and improve blood flow without the need of having to do a stent or bypass on every body. And so that was really the premise of my talk that I did at the European Society of Cardiology last month. And so and when I talked to the cardiology group in Bangkok yesterday at the wee hours of the night, these are things that are important because we're not really following the ischemia trials as well because we're just always used to doing what we always do. And so this is just options. I think that's a better word to really consider is what are your options?
Yes.
And that's a really powerful word to use because whether it's muscle, joint, cancer, heart, whatever it is, understand what your options are. And I think that's the big key.
Yeah, and that's what I always say is we're in the business of being in the know, like you are, right? Yours is focused on heart, ours
Yeah,
is
of
focused on overall health, but we need to know what's out there in the
course.
marketplace instead of
Yeah.
people trying to figure that out.
We refer people to emergent cardiology all the time, and then some people come from emergent cardiology to us all the time. Like it's a little bit of balance, but it's about knowing options. What are some options that you can do? That's the key.
Yeah, for sure. Um, so another issue is just mental health, and I'll go fairly quickly on this, but I think I talked about access before. Accessing mental health professionals is very difficult. In Canada, the average wait time to see a psychiatrist is anywhere from 6 months to a year, unfortunately. So there's two issues when it comes to mental health. One is getting access quickly, and the second is seeing the right specialist. A lot of times things can be solved through a social worker, a psychologist, a psychiatrist. People don't know even which of those specialists they should go to. So again, you need an advocate to help you get to the right specialist in a timely manner. And we've actually just developed a new program called Mental Health on Demand, which means you are talking to a level 3 clinician within 1 or 2 minutes, right? So you're not waiting weeks or months to get the treatment that you or your family may need. So again, my intent today is just to share what's out there today in the marketplace because a lot of people don't even know this stuff's available. Okay. So the next one I'm going to talk about is just nutritional counseling, and Diamond referred to this earlier. And if I had had this done prior to my marathon experience, I likely wouldn't have had that coma. And a good nutritionist is worth their weight in gold. And by nutritionist, I mean somebody that does the proper testing. So what I am often asked is, what vitamins do I take or what's my protocol? And I don't share it because every single one of us are different. Good nutritionists will do the testing and see where you're deficient. So I used to read, as I was doing sports and competing, I would read, take more vitamin B, take more vitamin C, and I would just keep loading up all this stuff. Well, through my nutritionist, I soon learned that, I don't need any vitamin C because my shake is loaded with vitamin C every day. But I'm deficient in vitamin B. And because I'm deficient in vitamin B, my methylation process isn't working, which means I don't absorb nutrients. I don't absorb magnesium, potassium, those types of things. So, for example, I do a micro injection of vitamin B once every 10 days that allows my body to absorb all those nutrients so I don't have a repeat of that marathon experience, right? Because the whole thing that I had previously, no matter how much I took, how many supplements I took, I wasn't absorbing them, right? So now I know that through my nutritional testing. I mentioned I went to had my blood tested this morning, not through my doctor. It's all my levels, my gut, my microbiome, my cortisol levels, my thyroid levels, my vitamin B, my magnesium, all my different mineral levels and everything. And every quarter I get that done because of my racing and whatnot. But my point is, a good nutritionist is worth their weight in gold. So
Absolutely. Now, I'll echo that for sure. And so, it's important to understand your markers. I think that's key, and understand your genetic profile. So, for those, I just want to jump in on that, Kevin, if that's okay, just because
100%,
um,
yeah.
methylation is a big thing when it comes to. I think that about 1/3 of people don't methylate well. So, let me explain that very quickly. Because you get these B vitamins that you take, and the whole goal of a B vitamin is to give you energy. And if you don't get that B vitamin into the cell, and that goes through what we call a methylation process. And many times people lack a genetic variant that doesn't allow that to happen. So then, yes, it's important to take then methylated vitamins or methylated Bs, or be specific to what you are. But the key is that if you stay deficient for a long period of time in something, this is how you can end up with having high blood pressure or abnormal cholesterol or diabetes, or the list goes on, anxiety, depressions, all these different micronutrient wheels. This is stuff that we do in our clinic to understand why you might have it. And a good thing to be able to do for people, and this is one of my favorite things that we do at the clinic, is getting people off of a medication. And it takes a while, but you then understand why the nutrient imbalances are happening. And that's a key factor when you talk about this. So absolutely, I agree with this 100%.
Yeah, it's just, you know what, again, it's just worth its weight in gold. And hopefully it prevents you from having to go see a doctor, right? Because you're doing the right thing. So the next one is on inflammation. So I'll just talk about inflammation for a second. So inflammation actually is a good thing. Like if somebody punches you or you break your arm and all the blood rushes in and the cytotoxins and everything else, that's actually a good thing because it's healing whatever the issue is. What's not good is chronic inflammation. So chronic inflammation is ongoing inflammation. It's the root cause of so much illness out there, everything from heart disease to obesity, cancers, rheumatoid arthritis, psoriasis, eczema. So we find this simple test. And if you Google food inflammation tests, you're going to come up with 1,000 different tests. Again, you need to know what I call as the gold standard, which is what we use with our members. But it will show you. It basically gives you three different indications: red, yellow, green. Red means you should not have those foods at all because they're inflaming your system. Yellow means you can have them, but have them, the odd time. And green means you can have those foods as much as you want. And typically there's only a few reds. And it has been a life changer for many, many of our members. We have people that thought they had, they stomach issues, Crohn's, just didn't have their energy wasn't well. They weren't sleeping well. And then they have this test, and simply by eliminating a food group or two, their life has changed. And I can personally speak of this. My son, who's very athletic, was on the national ski team. As a kid, from a baby, has had psoriasis and eczema, an inflammatory condition his whole life. and would put cream and take prescriptions every single day of his life and thought he would be on them for the rest of his life. Through my company, we found out about this test, food inflammation test. Found out his number one food that he should eliminate was dairy. Now, I'm not saying everybody should avoid dairy, but in his case, it was dairy. He eliminated dairy, and within 1 month, went off his prescriptions and has not been on them a day since, and has had no psoriasis and no eczema. Right, so I can speak, and we get story after story about that. So again, just my intent today is just share some things that are out there in the marketplace. Diamond, any comments, or have you heard of that test yourself?
When you talk about inflammation, um, you're right. Absolutely, it can happen, and your body should be put in a position where it can heal itself. That, I think that's the key. Is that, and I talk about the artery, and I'll talk about very simple, because no coaching session really with ours comes without me talking about the artery. Inside the artery is all muscle, right? It's not a pipe. I've explained this to you many times, Kevin, is that it's all skin. And when that skin gets damaged, that's inflammation. And then when it stays that way, then that's where cholesterol particle sizes, which is what we do in our clinic, sliver through. And then you have an infection response, just like a sliver going inside the skin. You're not able to poke it out with tweezers. And that's the three things that happen. Actually, 40 different biochemical reactions that I promise I won't go through. But the idea is that inside artery is all skin. And I'm going to just say one more thing when it comes to food inflammation, because this is stuff that we do in our clinics, is your endothelial lining, which is the inner lining of the artery wall. That's all skin. You also have a layer of skin. It's called the epithelial lining of the gut. And that epithelial lining should be nice and tight together. Those junctions should be nice and tight. And when you end up having inflammation to your gut health, then that's where things can leak into the digestive tract and right into the artery wall to cause havoc. And that's why the relation between food inflammation and artery disease is quite high, along with many other diseases, because if I attached your arteries together, your vessels together, it would go around the world almost 3 times, right? It would go around the world almost 3 times. And that means your arteries go everywhere, gut, especially head, brain, everywhere. Think about everything like that. And so 3 times around the world. And that's a lot of arteries that we have, right?
So again, great test, and another blood test. I'll just say a marker that many, for whatever reason, we don't get a lot of doctors that automatically do it, is CRP, C-reactive protein. That actually in general shows how inflamed your body is. So it's CRP is if you're having a blood test, I would recommend to get that. I'm gonna jump over here to again, because what we're really talking about is just advanced testing, and those are things you get through HeartFit, as you know. But another one that, and I call this a lifesaver as well. It's called a body scan, and it's a full body MRI. Years ago you would pay thousands of dollars for this. Clinics are popping up across Canada, and we're sending our members that want this type of test, but it shows early signs of heart disease, cancer. That cancer situation I talked about at the beginning, where we found the stage 1 kidney cancer, that was just a little shadow on the kidney through this testing. And it's a full body MRI, so there's no radiation or anything else. So again, it can be a very valuable test. I call it a lifesaver, because in many cases it shows, perhaps pre-stroke, or it shows arterial blockage, or it shows cancer, or those types of things that people aren't even aware. And I think, with all this testing, the goal is to get things early. Like, I read about this stuff every single day. Every day I read about health. And the whole key is finding things early. And we're fortunate because now there's tests like these and other tests that weren't even available a decade ago, that we can go and get tested. And then Diamond talked about this, which is genetic testing. So again, as we get genetic testing, this used to be thousands of dollars. Now the company we use is, $400 or $500. And I'm not talking like 23andMe, like, to your background and all that type of thing. I'm talking actually medical genetic testing really shows what you're predisposed to. So in my case, and I think Diamond mentioned he's exactly the same, I am predisposed to heart disease. My dad was the oldest of his whole family that lived to 72, supposedly healthy, dropped dead in the middle of the night of heart attack, massive heart attack, and supposedly was super healthy and fit and everything else before that. And so I am predisposed to heart disease. I've had my genetic tested. So what I do is I try to do everything I can in my power within reason to try to make sure I don't have clogged arteries, those types of things. So, I go and I've done the heart fit testing, which again, Diamond mentioned mine had come back very clear. I go for my calcium score. I go for my CT angiogram. My calcium score is 0, right? Which is, you can't get better than 0. So even though you're predisposed to things, as Diamond mentioned earlier, you can flick, it's called epigenetic. You can flip your genes on and off or change your genetic makeup by doing the right things in terms of lifestyle and whatever exercise and other things as well. So I have some people that say, I don't want to know, and that's fine. That's a personal decision, and that's what genetic testing's about. It is like, do you want to know? I would prefer to know and then do something about it, because my goal is to live and be on live for a long time, many years. So, um, lastly, the last thing, anything, Diamond, you want to jump in there on genetic testing?
I no, I think genetic testing is so important because then that way you can personalize uh, things that are off with you and then personalize nutrients that are off with you. So I think it's super powerful, especially when it comes to cardiovascular disease. But yeah, genetics. I think the biggest thing is once you know whether you are in terms of the genetics, then you then want to put those genetics in a dark room and don't turn them on, and that's the key. You want to turn that light switch on. So that's what you just called with epigenetics. So that's the best way I can explain that as to you want to whatever those genetics are you have. Okay, fine. I got a parent that has coronary artery disease. Okay, what can I do? Well, I'm going to put that into a dark room and not turn that light. So that's really what can we do to do that.
Well, and
Yeah,
through advanced testing and heart testing, because I pay a lot of attention to this stuff. The
yeah,
last test they did, they gave me arterial health, and my arterial health, they said I was 46, and I'm actually 62.
yeah.
So, that's, whether it's 46 or 48 or whatever, the point is you want to have good arterial health, right?
Course. And I'll just say something about calcium scoring because calcium scoring is great at 0, but it's all about understanding the non-calcified lesions. A lot of people who have heart attacks have 0 calcium scores or very minimal calcium scores. And I've seen people who have 1,500 plus calcium scores. They're probably on this call today, but I won't share who it is. Or we've got thousands of patients. But the point is that they have very, very high calcium scores and never have a heart attack. If you're trying to prevent a heart attack, it's about understanding the consistency of a plaque. Think of it like a pimple on your face. And so that's why the testing that we do in our clinic is valuable to see that part of it too.
Yeah, 100%. And the last thing I'll talk about is what I call functional medicine, which is when I speak quite a bit, as you know, to groups of people. One of the questions I often ask is, who wants to live to be 100? Who wants to live to be 100 years old? And I typically get less than 10% of people that put up their hand. Then I rephrase the question and I say, if you're active and healthy and you can travel and hike and play with your grandkids and all that at 100, now who wants to live to 100? And every hand goes up. And the reason for that is the chart on the bottom, is that the reason a lot of us don't want to live long is we picture the last third of our life as, I'll say, existing, not living, right? We're there, but our health's deteriorating, things are going downhill. And there's this whole other movement and there's communities around the world where people are living not just long, but long and healthy, which is called health span. And you've probably heard of some of these clinics. Dan Buettner has a documentary and books called The Blue Zones. And Dan is one of my heroes in that space, and I've actually visited a few of these blue zones. But and Dan's work, he actually was with National Geographic, and he was a photographer, and he'd go around the world taking pictures, and he realized there were certain places on the planet where people weren't living exponentially long, and not just a bit longer, like 10,000% longer, more centenarians, what he called them, which are people live over 100. So he started to study, and that's now his life's work, is what do those people do differently than the rest of the population? And that's really how we get into functional medicine, which would include a lot of the testing we've talked about. It would include heart fit testing. It would include all advanced testing, how all your different systems are working together, your metabolic, your cardiovascular, your brain function. So I just, again, my intent is to share with you what's out in the marketplace today. And there are these functional medicine clinics out there today. And again, you need to know which ones are good and which ones are worth their weight in gold, etc. And it's just very advanced testing because we have a lot of our members that don't just want to react when they have a health issue, but they want to proact so they don't get taken out by any of these things that they're unaware of, like I almost did when I look back. So that's what functional medicine's all about. So just to finish up, and then if there's time for questions, we'll have questions. But I guess my message as I started out is our health is our number one asset. So protect your biggest asset. And that's my message is, we often take our health for granted. I know I took my health for granted. I try not to take it for granted now. So protect your biggest asset because we're no good to anybody if we don't have our health. We're no good to our children, our families, our employees, whatever. Um, and a couple things I offered to Diamond and all of your customers is two things. Number one, if you'd like a call just to figure out or find out what we do as a company and how we could help you in your situation, the phone's open. So we'll send out the contact information. Just email me, call me, whatever. We'll book a call. And the other second thing is I shared my story when I started out. I wrote a book on it, and it's called "It's Never Too Late to Be Healthy." It's endorsed by Rich Roll, and he says this book is a little gem. Rich Roll is one of the leading triathletes in the world. It's got 35 of my favorite recipes in the back. It's got a sleep log, a log on your day, and it basically just shows how I changed my life around in very short order. And I'll say I don't take any proceeds from the book. 100% of the proceeds from the book go to support kids that can't afford to go to YMCA camps. So 100% of the proceeds go to send kids to camps. And you can go on Amazon and order it, and you'll have the book in a couple of days. So with that, I'd like to thank you for your time in the evening or afternoon or whatever time it is in your time zone. And Diamond, I'll turn it back over to you.
Thank you very much. I think if it's okay, Kevin, I think because it's such an important service that you offer in terms of health navigation, could you kindly maybe quickly talk about that? Like, I think there were some questions about. I know you don't like to talk about it in this setting when you're trying to give some valuable information, but I'm going to ask just because I know it's such a great service, and so just can you talk about a little bit about what Advoca is, if that's okay? Just in terms of, is it covered through benefits? Is it not? Is it private? Those type of things there.
Yeah, so Advoca, so we have a service called Advoca Health for individuals, and it's not super expensive. It's $95 a month single or $145 a month family, and that includes basically we become your health advocate. So we do, if you need testing through your clinic, Diamond, we would help people do that. If you need blood testing, advanced testing, through the public system, through the private system, you need MRIs, you need CT scans, you need a second opinion. It includes that second opinion service. It includes mental health. It includes coming to your home once a year and doing a full blood and urine profile. It includes coverage when you go to the US. So the best way to describe it is we become your quarterback for your health to help our members get the very best health solutions publicly. Most of what we do is in the public system. Some of our members do want private options, so we will arrange those. But we know again who to go to and how to get people to them quickly and efficiently. So it's a hybrid of public and private system, and we also offer those services to companies as well. So we have a scaled down program for employees. We have a lot of corporate clients right across Canada that put our program in for all their employees as a differentiator.
Yeah. And so for that $100 a month, I think it's worth it just when you wake up in the middle of the night and have that insurance to be able to say, hey, I'm feeling X, and getting that instant answer. I think that's super powerful. So,
Yeah.
but I just wanted to reiterate that is covered through benefits or healthcare spending accounts or things like that as well. Am I right?
Yeah, through a healthcare scanning account, or you can, it's a health expense, so it's deductible, right? Is the other thing. It's deductible, or you can use it on your income tax or whatever. Yeah.
And then there's another question about how often would you require a body scan? I think that would be maybe like
Yeah, that's a personal decision. I mean, I'll just tell you what I do. My wife and I used to go for the full executive medical every year. Now we alternate. We go for a full executive medical, which is all your blood tests and everything else. And then on the off year, we go for a body scan. Some people go every 5 years. I mean, the misconception is we think things just happen, and you would know this, Diamond. People that, oh, I just had a heart attack, or I just got cancer. Most of these things are slow. That plaque's been building up for like 20 years type of thing, right? Or in the case of cancer, most cancers are fairly slow moving, right? So it's a personal decision. I go every second year. I know people that go once a year. I know people that go once every 5 years. So it's personal.
Yeah, and when it comes to artery health, I mean, you can get an infection and really scale the process of atherosclerosis. And we know that just from COVIDs and that type of thing is that you can get an infection, it can start to hurt. Like viruses can start to, manifest itself pretty quickly. And so I think it's important to look at things, based on how you feel. But maybe there's some things that you do checkups. It's easy to do a quick checkup once in a while. So.
Yeah. Yeah. So bottom line is we're here to help. And my goal in developing this business is to help 1 million Canadians access the very best health solutions. And that's what our whole team goes to bed every night thinking we've done great work because we help people like you do, Diamond, help get the very best health solutions and outcomes.
Excellent. Kevin, how can we get a hold of you again? I guess if you can just write that down just lastly, I'll give it to everybody on the call as well, but just to finish up.
Yeah, so again, I'll send out the slide deck, and I don't know if you have access, if you can send it out, but
Yeah,
I'll give you my personal email is Kevin,
yeah,
K.Brady, Brady, at Advica, Advica, advicahealth.com.
perfect.
K.Brady at advicahealth.com.
Thanks so much. And thank you very much for everyone's time today. I know your time is very valuable. And I thank you very much, Kevin, for your time. Your time is super valuable. And thank you for providing that valuable information to us today.
Awesome. Thanks, everyone, and stay healthy.
All right. Have a wonderful day.
Thank you.